We have a lot of people joining us today, so just 1 minute and we'll get started. All right, my name is Corinne Waldow. I'm the Senior Director of Economic Vitality at the Boulder Chamber. Thank you for joining us this week. We are going to give you an update on numbers, and I know there's a lot of questions about mask orders around the state, so hopefully Tessa can get through kind of what's going on and talk a little bit about the difference between Denver and Boulder and some of the questions I've gotten. We're also going to make this an interactive session. It's a little different than what we've done in the past. We will be asking you some questions because we are seeking input on the mask order. I will put the questions in the chat and you can put your answers in the Q&A because that way you can stay anonymous or put your name down. We will also be answering your questions. So I'll keep track of which are questions, which are comments. We'll do that as we go along, but we will be asking you questions along the way and would really like your input. So get your fingers ready. At this time, I'm going to hand it over to Tessa so she can get started, and then we'll do as we normally do, answer questions and ask you questions today.
Thanks, Corinne. I'm Tessa Hale with Boulder County Public Health, and I appreciate all of you hopping on this special session today. As Corinne said, there's a lot of questions around the mask mandate that we will talk about Boulder County's strategy with that. But first, I want to start with an update of where we are with numbers. This is as of February 1st. So again, we continue to see the same trends happening in Boulder County that are happening across Colorado. We still have a backlog of data. I heard earlier that there are 12,000 cases that have yet to be entered with demographic data. The case counts are in there, but just information about the details on who has contracted COVID is forthcoming. The case numbers, while declining, still remain very high. The good news is hospitalizations are decreasing. However, we'll talk a little bit more in detail, but hospitals continue to have challenges because there's a backlog of non-COVID needs and there's still staffing shortages. We continue to see deaths rising. The testing positivity has decreased this week, and we have seen this new variant of Omicron, BA.2, that is starting to become a more dominant strain in some countries. We still don't have a lot of information about BA.2 yet. We do understand that it is more transmissible, but we don't know if it's more severe or if it evades immunity. So there's just a lot of unknowns. It has been detected here in Colorado. So as you can see here, our case count has dropped significantly. That peak that we had, I think January 15th was the highest day, and it's dropped. So this looks very promising, but I would just still urge you to look at the total case count and see how high we still are. We've made great progress with all of our mitigation strategies and want to continue on this downward trend. As I said earlier, the case counts, this is mirroring what we're seeing in the rest of Colorado. Across the board, case numbers are dropping. And as you can see here, all across all age groups, trends are dropping as well. The 7-day positivity rate is lower. It's not as dramatic as a drop off. And as I've shared before, it's also important to note that there are home tests that are not reported to the state. So in terms of actual positivity rates or people who don't have an opportunity to get tested or don't get tested that aren't counted in this rate, in this case number, in this 7-day positivity rate. With regard to our healthcare system and capacity, the average is confirmed has decreased by 15%, which is really promising and really wonderful for our healthcare system and our healthcare workers. The ICU bed availability is at 9%, which is a 2% increase. The surgical bed availability is the same. There's still tight staffing. That's improved very slightly with a 59% staff shortage as compared to 62%. And right now there are 42 confirmed cases, pediatric cases. Hospitalizations, there are 69 people hospitalized with confirmed COVID. And I'm going to talk a little bit more about, I know there's often questions around COVID cases in hospitalization. I have a little bit more data to share in some future slides. And then the healthcare system responses. At the end of January, the State Department of Public Health and Environment extended and amended the order that requires individuals at 500 or more people in an undesignated seat show. That requirement to be vaccinated was lifted. So I know there's been some questions about this and if it has some sort of impact on the vaccine verification program in Boulder County. It is a completely separate order. So this is for places that had events, large events with 500 or more people without assigned seating. Previously, the state required vaccination of everyone attending. That has been lifted.
I just want to clarify that particular order affected very few facilities in Boulder County. So you know who you are if you were under that order, and most have reached out and said that means that's off for us, right? So very few facilities actually hold unseated public indoor events of 500 or more in Boulder County.
Thanks for that clarification, Corinne. The combined hospital transfer center plan remains at the tier 3 transfer patients to best managed resources. So people are being placed in hospitals that have the resources available, and the crisis standards of care, which we've talked about before, is not activated for hospital care. We don't have updates on the therapeutics. We do know that it's been limited, and as case counts in hospitals decrease, there will be more therapeutics available because there are fewer people needing them, but I don't have any details on that right now. And then the seasonal flu hospitalizations remain low compared to the pre-pandemic seasons. Okay, it's not it. There it goes. Okay. We've had 91 deaths since May 2021 and 348 deaths in total. There were 12 more deaths that are going to need to be recorded. So just while, you know, it seems as though case counts are lowering, they are lowering, people are still dying from COVID. It's just something to remember as we think about our mitigation strategies. Our vaccination rates, 70% of Boulder County residents who are eligible, or of the total population, have been vaccinated, and it's 73% of the total eligible population. I'm going to talk soon about some opportunities for people who want to get vaccinated. In terms of boosters, the third dose, as you can see here, we're continuing to increase the number of people who have received their booster. We're highly encouraging this. It's very helpful in protecting against Omicron and in possibly other future variants. Here's that information. This is state information. We don't have it specific to Boulder County, but this talks about cases and hospitalizations. This is breakthrough data and hospitalization data for people who are vaccinated versus unvaccinated. And I think that the takeaways here is that the vaccine is very protective. And if you look at the deaths, there have been 44 deaths of people who are vaccinated, and that number is 647 for people who are unvaccinated. And likewise for hospitalizations, you know, it's 8.2 vaccinated per hospitalizations versus 52. So we just can't urge enough how effective vaccinations are. Here you can see, this is something that we've shared before, that when you have a booster, you're 25 times more protected against Omicron. We know that there are a number of breakthrough cases. However, people who have a breakthrough case when they are boosted or vaccinated have milder symptoms than individuals who have not been vaccinated. The CDC changed what they're updated. They didn't change anything. They updated what it means to be up to date on vaccinations. And so I just want to be sure everyone understands this. So When we're talking about fully vaccinated, we're talking about 2 doses for Pfizer and Moderna and 1 dose for Johnson & Johnson. And you're considered fully vaccinated 2 weeks after that second dose. When we're talking about up to date, what we're looking at here is that if you're 5 months out from your Pfizer or Moderna booster, or 2 months after your Johnson & Johnson, you're eligible to get a booster. And then once you receive that booster, you're considered up to date. And as that previous slide shared, you're much more protected against Omicron with having that booster dose. We are having clinics and the Boulder County Fairgrounds. It's a really easy way to get vaccinated, to get boosted. It's just a drive-through. There's a lot of appointments available. I will share these slides with Corinne, or you can go onto our website and just make an appointment. There's a lot of availability 7 days a week. Super easy. You just drive in and you get your booster or your first vaccine. This is just the outcomes of the clinics and how many people are coming through. So we see a great number of people, and most of them are boosters coming through, but we encourage everyone to be using this free booster option or vaccination option. There's also a free mask initiative. There's right now the federal government is providing free masks, N95 masks. You can go online to look and see where they're available. I know that pretty quickly the library ran out, but there are other places that they're available. There's also an initiative for community partners that you can link to through this presentation that I will get to Corinne. We are still urging during this high surge time to take precautions, primarily get yourself and family vaccinated, get a booster if you're eligible, and wear a snug fitting high quality mask. Okay, now to the part about the mask mandate. And so the first thing I want to clarify is that, I think there's been some misunderstanding that we have extended our mask mandate here in Boulder County, and that's not the case. The way that our mask mandate was written is that it was tied to the case counts, and that when we got down to a low transmission rate as defined by the CDC, which was 50 per 100,000, that's when our mask mandate would end. This was developed during Delta, which was a much more severe strain of Omicron. When we look at how other counties developed theirs, they were always set to expire. In fact, Tri-County and Denver initially wrote theirs to expire in January, and they extended theirs, but they are now letting them expire as was written in their orders. Jefferson County is having a Board of Health meeting to discuss that. Broomfield is also expiring. Larimer County has decided made the decision for theirs to expire on February 12th. Boulder County Public Health Board of Health is having a meeting on February 14th to discuss this. And currently what we've been doing is reaching out to our key partners and getting some feedback about what is the safest thing to be doing. We know that there's a new variant of Omicron. We know that in other countries, for example, in Denmark, while case counts were dropping, this new variant has caused another surge. We want to be extra cautious before we make a decision about ending the mask mandate, and we really want to make sure that our healthcare partners feel that it's going to, they'll be able to provide the care that they need to our community. And as Corinne said, we also wanted feedback from this group on how you all feel about it. And so it's really important to us to understand how the community feels with regard to safety. We know that this has been a big impact on your business, and that the Boulder County Public Health Mask Order went into effect months before the surrounding counties, and that we are continuing, ours is still in place. And so we're very mindful that that has a big impact on your businesses. And so we appreciate hearing from you what you think about it, and we will keep you informed and be transparent in the decision-making process.
I'm going to interrupt you real quick. I put the first question into the chat if people want to start to, give us feedback on that. And that is what concerns do you have about releasing the mask mandate? So if you can answer, so we're hearing a bunch of people saying, when's it over? But what are your concerns? Because there are businesses that are concerned about releasing a mask mandate. So if you could put those answers in, then we can move on to some of our other questions, and then I'll ask some of the other questions later. All right. Are you ready for questions, Tessa? While we're waiting for people. All right. Actually, I want you to bring back up your slides because there was a data question, and you're not going to be able to answer it with your data chart, but we'll at least be able to talk through it. And if you could go back to the slide that has the ICU beds.
Okay.
All right, so we're hearing there are concerns about, mask mandates and the pressure it puts on businesses. So we will continue to take your feedback on that. Now, the question is about, you're on your end of slideshow, but if you go back to the ICU beds, there's a question about what's the typical ICU bed availability around this time, normally pre-COVID. So on the slide, it's the 11.
Yeah, I'm just trying to, there it is.
Okay, so this goes back, I don't know when this goes back to May 2021. So we see that the number is pretty high as far as the number of available ICU beds. I'm wondering if you have some insight as to what the typical number around this time of year would be without COVID.
I don't know that information, but I will find out.
Okay. And I know that on the website, there's more information on how many ICU beds there are available in the county, in the chart that's available there. But that is one question that has come up. So that only goes back to May 2021, if I look correctly. All right, we're getting a lot of when's this mask are going to be over, so we'll get to that piece later. One question is about this. Nobody is talking about needing a second booster yet. A certain number of months after the first booster of Pfizer, Moderna. Are they talking about that? Just want to make sure that people aren't missing that there might be a fourth shot. So.
Yes, we're waiting for the CDC to come out with that information. We don't know that right now. We do anticipate that having regular vaccinations against COVID will become a normal series of vaccination recommendations, just like the seasonal flu shot.
Okay, thank you for that. Now, we've had recent news that Moderna was also approved by the FDA, so that's also for 18 and above. So that is news this past week. We have a lot of answers coming in. We're gonna get the feedback we want. Why is the Board of Health meeting so far beyond other counties? So why is the Board of Health meeting on the 14th when other counties might have met sooner, or were sunsetting sooner, or were some of these decisions made before the Board of Health meetings? That's one of the questions.
Yeah, thank you for that question. So this is our normal Board of Health meeting that we have. We did not, we wanted to be sure to have enough information when we came to the Board of Health to make decisions. And so we did not call for a special Board of Health meeting. And the other orders in Denver and Tri-County did not require a meeting. They were written to just expire on those dates. Jefferson County is having a special meeting to discuss this. Boulder County, we have been really protecting the community. Our priorities are to keep kids in school, keep businesses open and running, and to protect our more vulnerable populations and people who can't get the vaccination. And so that's why we have these mitigation strategies in place. And we just want to be really careful and intentional before we make any changes. That's why it's looking different than in other counties.
Thank you. And I got a lot of calls this week of that misconception, and I just want to repeat it again. There was this misconception that Boulder was extending its mask order, that was the case. And I think the misunderstanding is that it was not a sunsetting order. In the past, previous to this most recent order, every month it had to be extended. But the way this was written was that it didn't sunset. We had to hit numbers. We had to hit 50 per 100,000, and those were based on Delta. So when I got those calls, it took a little bit of time just to go back and say, no, those other orders were easier for them to release because it was sunset. It was set to expire. Just as you said, they didn't need a Board of Health meeting. There were a lot of different pressures in there. Jeffco hasn't made their decision yet. Larimer is waiting a little bit before they gave 2 weeks notice. So I just want to make sure that we're clear that 50 per 100,000. Now we're nowhere near the 50 per 100,000, Tessa. Are there any thoughts about changing metrics, or what metrics might be looked at? I might be putting you on the spot there, but
yeah, that's a great question. Thank you. Yeah, I think that we recognize that things, as they keep changing with COVID, have changed again, and that this new variant isn't as severe as Delta, and that the numbers are declining. And so, but at the same time, to get to that 50 per 100,000 is a ways out. And so we're taking a look at hospital capacity. We're taking a look at what could be the impact of this new variant. We're just getting all of the different information as it's changing to try to make the best decision to keep the community safe. And so I think that likely we will be moving away from that 50 per 100,000, but I don't have any information about what that other piece will look like at this time. And just to also let you all know that modeling from the Colorado School of Public Health does show, that there's a continued decline, but that modeling was based on people continuing to wear masks.
So that actually leads to the next question. So our cases are going down because of our mitigation strategies, but other counties without them seem to have surged and then downturned at the same time as us. Have we done actual comparison to see what is due to mitigation strategies and what's due to the variant just rolling through?
I think we wish we were able to have that data and have it be really clear. I think that absolutely, the mitigation strategies have helped to drive it down. I think there's no doubt that all of these mask mandates ended up being put in place, and we saw a downturn in cases. There's just a lot that's also unknown, and I am not an epidemiologist and would defer to the experts on our team who could probably speak more to that. But the mitigation strategies have been a key piece of preventing further spread in the community, along with vaccinations.
So let's go back to a couple of your data points. First off, have experts looked at natural immunity yet? I know you're not an epidemiologist, Tessa, but I am putting you on the spot for some of these. But, what is the expert's opinion on natural immunity? What's, herd immunity? What are some of the conversations happening around those?
I think we do know that there is natural immunity. What's not known, what hasn't been studied that we have information about, is the length of that or the protection against different variants that come. That's where we have more data around vaccination efficacy. And in terms, the herd immunity, yeah, I think that the modeling is projecting that Colorado is going to reach herd immunity at some point. I think I just want to put out there is we've all ridden this roller coaster of COVID, that it seems like we're coming out of the woods and then there's a new variant. And so, all of the information we have changes on a daily basis. And I wish I could tell you more, had more information to project into the future, but I don't.
Thank you. And a lot of people, there's a lot of chat going on, a lot of people agreeing with each other, saying other points. I'm actually going to put the third question in. The second question is when would you like to see the mask mandates set in the community? Gotten a lot of answers to that already. So I'm going to put the third one in. And that question is, what are the key messages that would help support sunsetting this mask order? So it's those messages that we need to make sure are presented about, especially for businesses that want to keep the mask order. We've gotten quite a few that say, I need to keep it. I need to keep my clients and my staff safe. We want to be consistent with the school districts and so forth. So what are some of the key messages we need to make sure are included? And that's the next question. Not for you, for them, for the audience. Right. So can you answer the question of how many people are in hospitals for COVID versus how many found out they had COVID because they had hospital testing?
I
I know
don't
you,
have that data. I know that there's, information about the incidental COVID cases that are in the hospital, and I don't have that broken out to share.
okay. Does having the flu or a cold provide any COVID immunity?
I'm going to say no, but I can't say no for 100%.
Okay. Could you bring your slides up again? I think this might be something where we won't bring down your slides in the future until we get through the metrics questions. Can you bring up the slide that's the case counts again?
Yes.
And just maybe show that one more time. And then, so our current number approximately is about 762.3 per 100,000. Again, nowhere close to the 50 that would our mask order in Boulder County would allow for the removal of masks. So that is one key piece to keep in mind, which means there needs to be active deliberation within the Board of Health to talk about the mask order. So looking at this, do we know the effects of the case reporting lag on this? Is it really having an effect on this in general?
No, so the case reporting lag isn't going to have a change significantly what we're seeing here. It's, this trend that we're seeing would remain generally the same.
Okay, so it probably be trend. So even with the case lag, we're still seeing a decrease, because I know when the decrease first happened, they put some caution out there, like that might be because of the lag, but because we're seeing sustained decrease as we get through the lag in the case reporting and the testing. Can we clarify? So I've gotten this question a couple times. We can increase the number of places that have testing. We can increase the capacity in testing, but most of the tests go back to centralized labs, and it's really around the lag in the labs to test these tests, correct?
Yes, thank you for clarifying that. And then, it also goes back through the reporting that goes through the State Department of Public Health, and then it comes to us.
All right. Well, we have a lot of comments in here, so I'm trying to get through the comments and the questions. Is there a way to find out if a company has already had complaints against them for not enforcing the mask order?
We do not publish that information.
But
I'm
if
just trying to
you are
clarify.
that company, but if you're that company, you're most likely have been contacted by
so
public health in some way.
Exactly. So, the way the masking enforcement works is when there is a complaint, our masking enforcement team will contact a business to provide some education around the mask mandate. If there are ongoing complaints, then we take further action for enforcement.
So I've done this one a lot too. There's been a lot of activity and questions. I will say that, I love that people ask the questions, because, it makes sure that we're up to date on your information. Sometimes when it was the first time something happened to you, my first positive case at a business, remembering everything you learned at these webinars is sometimes overwhelming. So, asking those questions over and over again is okay. So someone asked this question. It's about the free at-home tests. They're being delivered in the mail and on porches via Amazon and FedEx and all of that. And you don't know when they're coming, and they might be staying out in the mailboxes for more than a certain amount of time. And our temperature is below 36 degrees. Is that cold when the recommended temperature of the test is to remain between 36 degrees and 90 something? Is that going to affect the efficacy of those tests if you don't get them out of the cold immediately?
Yes, it is recommended to keep it within that temperature range that's listed, and it's smartest to get rid of those tests if they have been outside in the cold for a sustained period of time. And I would say that you can get the free tests from two sources. From the State Department of Public Health and Environment has a free COVID testing link, and then as well as the federal government.
And, you know, just knowing that they are taking anywhere from 5 days to 2 weeks, and just check your mail daily. I think, you know, they may still, the efficacy does go down. So you shouldn't trust the negative result necessarily of a test that's been out in the cold, or any of the tests that are at home necessarily to make those decisions, like I'm gonna go see grandma, or I can go back to work. That's always been the case with those tests.
And for anyone who is feeling sick or has had a real direct exposure, we just recommend still that you would stay at home until you have a negative test from a functional source.
And people are clarifying that the federal tests are being delivered by U.S. Postal Services. The state tests, though, are being delivered to your front porch in a lot of cases in this little box. You showed it last week, this little box, and they're going onto the front porches because they're being delivered directly from an Amazon or FedEx or something like that. They're being ordered for you. Thank you for keeping me on my toes, everybody. So if you're part of the vaccine verification program, let's talk about the vaccine verification program real quick. Is the booster shot required?
The booster shot is not required. We encourage that people would have boosters or be up to date on vaccinations. You know, we were looking at making a change to the program when things came about related to the mask order being lifted, and our vaccine verification program is tied to the mask order. So I would also, Corinne, if you could throw in a question after our fourth question, just curious to know how many businesses out there would be interested in keeping a vaccine verification program going after the mask mandate ends.
Thank you for doing that. Yes, I will put that question, and I'm also going to send these questions out in the email tomorrow so I can get some more responses on the hundreds that we have on today's call. There was another vaccine verification program question or comment saying, you know, it's hard, you know, keeping these vaccine requirements, keeping this when that 500 or less is gone, when Denver is, you know, not going to be pushing it as much, when some of these other counties that had it in place because of the mask mandate, when they took away the mask mandate, they, you know, they're not doing it. It's going to be hard for our facilities here in Boulder County to continue. Is there anything specific to recent Colorado public health orders that affects businesses, specifically those that are vaccine verified facilities?
No, there's been no changes aside from that 500 plus event.
And we have one of those on today's call, and even though it went away for the state, if you're part of the vaccine verification program, you're still going to need to require vaccines.
If you want to stay in the vaccine verification program. And so I would just also reiterate that it is a voluntary program. The vaccine verification program, we love our 315 businesses, facilities that are participating. It's 100% voluntary. And so if anyone at any point doesn't want to participate, they would just need to let us know, and then they would need to require everyone to be wearing a mask, and as long as the mask order is in place.
Okay, next question. We're all over the place on questions today. Usually I'm able to group them together, but there's no groups of questions. Is a company party in office against public health orders? There's food and drink, there's mingling. Is that against public health orders?
A company party for a non-vaccine verified facility would need to follow the masking orders, which is that you can remove your mask while actively eating and drinking. And at all other times, people would need to be wearing masks. Does that answer the question?
Yes. So if someone's not part of the vaccine verification program, whether you're sitting, you're seated, if it's indoor, you need to, the only order that's really in place for that particular setting would be the mask order when not actively eating or drinking.
Yes.
And I think in some cases, this was not somebody asking for themselves, but having observed a party that was going on. Can you shed some light on Boulder County Public Health thinking around the mask mandate overall versus within the two schools? You know, having different rules within schools and
Just
childcare spaces versus indoor spaces has been a challenge if you work with children?
having different orders in place. So, right. So we do our masking order for K through 12 was implemented before the school year began, and it is separate. So whatever happens with our with the mask mandate for the community will be separate from K through 12. The reason we have the K through 12 mask mandate is because first, not all kids are eligible to get vaccinated and therefore don't have the same opportunity for protection. We also know that masking is really effective at preventing the spread, and we want to keep kids in school, in person learning. And so that's why we have that in place for schools. And I don't know if the question was that it's hard to have this.
Two different mask orders, but even in Denver, where they released the mask order, they're keeping it in Denver public schools. So there are
Yes.
counties that are doing that. Tri-County, Adams 12 is releasing the mask order, so that's a different. I mean, I think it depends on the school district, but those are different orders than the mask order. Okay, so a lot of key messages coming in there. We should be able to give your leadership team some good information. I think there's still some frustration and questions around why we're waiting 2 weeks on the 14th to have a meeting when others are removing the mandate now. Now, again, they're not removing, they're sunsetting their orders. So their orders were set to sunset and they could have extended another month, but they let them sunset. So what's the logic to meeting in 2 weeks? What are the, you may not be able to answer all this, but what are the steps that you're having to go through to get all the information to have that Board of Health meeting?
So Boulder County Public Health leadership is soliciting feedback from you all, the business community, from the healthcare system, from our municipal partners, from K through 12 education and early childhood education centers. We're trying to get as much information as we can and align that with the trends that we're seeing happen globally. What's happened in Colorado is often reflective of what's happening in other countries. And as I mentioned, in Denmark, we saw a new surge happen with this new variant of Omicron 2B that is now in Colorado. And so I think we recognize that it's hard, it's frustrating, and at the same time, we want to do the best to protect those who can't be vaccinated and are more vulnerable individuals, and also keep things open and running to the best as we can. Because as I'm sure many of you experienced during the surge, there was a lot of people out sick. A lot of businesses we know had to close down or operate on a limited basis. And we know that masking really helps prevent the spread. And so we're just trying to make the most informed decision possible.
We've gotten quite a few comments in that say, and I'm not actually making live some of the Q&A comments, but a lot of comments that say 2 weeks wait seems appropriate when numbers are still high. So we still have some support. I know I have a bunch of people coming in saying release it now, but we do have a bunch of businesses saying, please, 2 weeks seems right when we're still at 762.6. Will the health department be discussing the mask mandates for both businesses and schools? Will both orders be discussed, or are we just looking at the primary order?
Both orders will be discussed at the Board of Health meeting.
And then the follow-up to the question about schools versus are those businesses that serve youth? So if the schools still have it in place, and then if a mask order was to be released for businesses or indoor spaces within the county, it would put those businesses that serve youth into a bind, because a lot of them would like to keep, need to understand their role, whether or not they need to keep it, or understand how they can continue to communicate, necessary masking because they serve such youth.
Right. Yeah, this highlights, how complex and challenging all of the decision making behind this is. And so I appreciate that question and comment. And I think it's one of those things that's really important to get to leadership as they're preparing to have this discussion with Board of Health, because these are very linked. And so we want to be able to consider what all of the impacts are of the orders and changing any of the orders.
And I do have this particular, so, they're in a bind, those that serve youth, and, the expectation that youth are wearing the mask, they're in a bind. So I will make sure this comment gets put through as well. Can the community watch the public health board meetings?
Yes, we welcome people to watch. There's on our Board of Health website, there's a link to watch it live. You're
And I
also able
send it
to
every
provide.
week in the email is the link to the Board of Health meetings. After the last mask order, I've made that literally a link. It is a public meeting.
Yep.
So it is something that people can attend. There is a comment period. Nobody's particularly is invited. No business sector is invited to attend. It is open for you to attend those meetings. So I will make sure I send those out again. But if you look up Boulder County Public Health Board of Health meeting, there is a page that gives you direct instructions, and those are still online, correct?
Those are still online, and people who are unable to attend but want to have their voice heard are welcome to submit written comment. That information is also there.
Okay. We're acknowledging, people are acknowledging so at the end of this meeting, I'm going to, there's a question whether I'm going to send these questions out, and I will send these questions out for those that are not on today's meeting to talk a little bit about how, and I'll add your extra question, would you continue a vaccine verification program? We've actually had a couple people say it's been a lifeline for their business. I will send this out. I'll ask you how it's affecting, we can ask the question how it's affecting your business. And then we can also add that extra question about vaccine verification. I'll also resend the link. Once this is live, I'll resend the link to the Board of Health meeting, knowing that Board of Health meeting is February 14th. It's what we all want to do on our Valentine's evening. So. But it's important. We did see, there are a couple people on this call that were on the last meeting. They were heard, and the actual change to the while seated, eating and drinking while seated was changed at the Board of Health meeting, thanks to the respectful comments and that were brought to the table from businesses across Boulder County. So I'm going to see if there's any more questions. Somebody did acknowledge that once the mask order is removed, it'll be very hard to reinstate if needed. And I think you and I have had that conversation as well. All right, looking to see, are there any other?
That is just to reiterate. That's part of why I think in terms of taking 2 additional weeks, it's also that once this order is lifted, it will be next to impossible if we were to need to try to do this again. And so it's just being as informed as possible and making that decision is what leadership is doing.
And thank you for soliciting input. I know that I was one of the people that you've talked to. People said it's not because we did reinstate it over the summer, but with the public health fatigue and the fatigue towards this, there is this feeling that it may be hard to reinstate in the future, but it potentially could be. All right, there is a question, and I'm not sure you're going to be able to answer this one, but I'm going to ask it. Does Boulder County have money to support businesses who have to close due to outbreaks and no longer have federal support for COVID sick pay?
There is not a direct funding bucket. However, if people are following the ARPA, American Rescue Plan Act funding strategies that is being led by the Boulder County Commissioner's Office, that would be the best place to look at what kind of funding is happening with local ARPA funds.
Okay, well, we just started a little debate on the chat. People think we could bring it back. It's actually harder to keep and enforce an order when we're the only county. I'm just trying to summarize some of these. It's equally hard to be that only county requiring, especially when you have a lot of your workforce of people coming in. But we do have those that say, I need this for my business and for the continuity of my operations. So I want to make sure that if you do release the mask order, that there is a way for us to be protected as a business to be able to continue to require it. Those types of things.
Yeah, I would just to that point say that we will always highly encourage people to be wearing masks while we're in a high transmission, regardless of whether there's a mask mandate in place. That would be a number one public health recommendation. So we will support businesses in that regard. And right now there's so many great N95 masks available that, we would want to continue to support and encourage people to be using masks.
All right, let me ask a couple more questions, not around the mask. They're not technically around the mask order discussion that's going on, but to verify in an open space within an office, everyone needs to be wearing a mask even if they can socially distance, correct? And this is a non-vaccine verification facility.
Yes.
Now, if somebody were presenting, up at the podium wanting to present, they can remove their masks as long as they're 12 feet away from the audience, correct?
And the audience is all fully masked.
Okay, and this is non-vaccine verified status facilities. All right, so any other questions? I'm seeing a lot of comments in. Believe me, I've captured all of these. I'm multitasking today, capturing the comments. We will capture the Q&A. I think we asked the final question. We asked the question about when people gave those. I'm good now. I'm good in 2 weeks. I kind of want to keep it. We have a little bit across the board, but a lot of I'm good if you were to get rid of it tomorrow. We have, there's my dog. We also have the question, which is, are there any metrics that would be better ones to see as far as tied to the mask order, or what metric would you want to see in order to see the unmasking? I think a lot of people have already answered that in the fact that they either said now, or I'd like to see case counts down, or I would like to see hospitalizations down. I think we got those answers through the other comments. So my puppy is not a puppy anymore. All right, let's see. Okay, so why does somebody in an office or place of work where everyone has been fully vaccinated or has had COVID still need to wear masks?
So the mask mandate is in place with the exception to wearing masks being the vaccine verified program participation. Even if we don't know, natural immunity is not something that we are using as part of our exception to the mask mandate. It's only vaccination that we're using. And so that is why if you're in a facility that's not part of the vaccine verification program, you need to be following the mask mandate, or you're welcome. We would encourage and love to have more people participate in the vaccine verification program.
Great, thank you for that answer. Again, there's if you've already had COVID, some people got Delta, but then they also got Omicron. So there isn't exact science on how long you're immune to it, or if you're immune to different strains. So that's why the masking and the vaccine verification program do not take into at this point. That's what we heard from, we had epidemiologists on at the beginning of all this. You're not an epidemiologist, but those are some of the trends we're hearing from them. So there's a question, wow. There's a couple more came in. There's a question about singing at church if a mask mandate is discontinued. I'm trying to see if I can find it. No. Right now, you have to wear masks, and if you're on stage, as long as you're 12 feet around from other people. But if a mask mandate's released, will there be restrictions on activities like singing in church or?
I can't predict what a future order will look like based on the Board of Health discussion that's pending. So I don't know, but I believe if the mask mandate is lifted, then it would be lifted for that. I can't predict if there would be some sort of restriction, but I would imagine if the mandate is lifted, then it would not impact choir singing or other performances as is written in the current mandate.
So I'm going to have to ask you a favor, Tessa. I'm going to need you to go back to the epidemiologist and ask about natural immunity, because apparently there's comments about, and I'll send you the questions, about BVSDs using natural immunity after a certain date. And there's, can you provide resources on why natural immunity is not being used? So I will send those to you, but I'm going to need, like we did in the previous ones, if you could get some answers to that. We've gotten quite a few questions about
Yeah,
that.
I'd be happy to do that.
Thank you. So we know you're not the epidemiologist, but if you could get answers from the epidemiologist, because neither one of us
That I can do.
neither one of us even want to play an epidemiologist or lawyer on
No.
TV at this point. Have we thought about what the end looks like? We're not talking about the end of, like, the end of COVID. Is it going to be endemic? Is it going to be something that we live with, and end just means we get past a certain period? What does the end look like?
That's a great question. And I can also pose this to our epidemiologists. But as I understand it from participating in meetings with them, is that this is going to become something that we need to continually protect ourselves against, with vaccines being the most effective way, and that there will be new variants just like the seasonal flu that we've been living with for many years.
Thank you. And whether or not, we're going to need to keep doing vaccines and so forth. All right. So somebody asked me a question I'm not probably going to be able to do, which is, because this has all been streaming via Q&A and via chat, whether or not I can estimate the number of people that are for or against, relieving the mask order immediately or waiting. Or I will say we've gotten a mix. It's been a mixed bag of, I'm fine being conservative until a certain point. 2 weeks sounds about right now. So I think we've had a mixed bag of all of that, especially it depends on the population. Remember, this is a cross industry session. So if you're serving certain populations, you might be more risk averse than others. Let me see if any other questions have come in. Some people have actually submitted some data answers for us, so that's good. Let's see, any other questions for Tessa? We will put this presentation out, the recording, questions. I appreciate this being a very dynamic and back and forth session using Q&A and chat. I appreciate the input. We really wanted to solicit your input to understand the answers to some of these questions. Anything else? Just giving that last call. And again, will we need another booster? You answered that a little bit earlier ago. That being,
we're waiting for the CDC to come out and let us know.
We're getting a lot of responses, so I appreciate the back and forth. Again, everything you submitted today will be submitted to Tessa and to the leadership at Boulder County. They really did want to ask me to get this feedback from you today. All right, with that, we do have a session next week. We'll see and it will be Lane again. Tessa will not be available, but we will have Lane back. You all know Lane really well from over a year and almost 2 years. I think we're coming up on 2 years of these. And then we will, as soon as after the 14th, we'll discuss whether or not we have a session that week, because we're not scheduled to have a session that week, but we could potentially do one. So hold the 1 o'clock slot on that Thursday. In the meantime, thank you, everybody. Thank you for voicing your opinion, asking your questions. As a reminder, we're available for you to continue to answer. And
thank you, Corinne, for hosting this and getting this great feedback that's really helpful for the decision-making process. Thank you, everyone, for providing your thoughts.
Last minute feedback, and then I'm going to call it good and say goodbye. We will send you an email with all that. Board of Health meeting is a public meeting, so just as a reminder. Thank you. Just getting the last feedback, sorry. Thank you, everybody.